Um, I'm going to hit start. Welcome, everyone. Today is Thursday, February 12th, 2026. Do you not know how we're halfway through the month of February, basically, already, and that Valentine's Day is right around the corner? What the heck? But welcome. You're here today for a session of Lunch and Learn on acceptance and commitment therapy for body image. We're joined by Raquel Griffin, pardon me, and Lee Thomas, who will be leading us through the session. This is a webinar, and you'll have access to the webinar chat and the Q&A function, but you won't have access to your microphone or your video functions. So however you're arriving, I hope you're feeling cozy and warm in the snowy weather and ready for the session. Before we get started, I do want to begin with a land acknowledgement, and I want to begin by acknowledging that I'm speaking from Guawageachk, which is the Mi'kmaq name for Citadel Hill. It's translated as Big Pine Hill, and is located on the ancestral and unceded territory of the Mi'kmaq. The inherent rights of the Mi'kmaq were recognized in the Peace and Friendship Treaty signed with the Mi'kmaq, Maliseet, and Passamaquoddy peoples from 1725 to 1779. This series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between nations. Canada later reaffirmed the treaties in Section 35 of the Constitution Act of 1982, and they remain active to this day. And so I just see a note there from Nancy. Sorry, I'm not sure why you wouldn't be able to hear anything. It might just be you, because we did test and the sound is coming through for other folks. So you might want to just pop off and then come back in. That might help. So with all of our sessions, as we take an active stance and strive for decolonization in our work, it's important to consider the ways that the concepts of today, the topic of acceptance and commitment therapy and body image, relates to decolonization. And so I invite you folks to think critically about the ways that settler colonialism and white supremacy co-construct the forces or the factors that lead to many of the challenges we have around body image and our own care and wellness. And with it, land acknowledgement, it's important that we move towards action. I'm thinking specifically around the Truth and Reconciliation's calls to actions, but also just as we think about decolonization, we also have to think about the ways as helpers and social workers we can support and work on allyship or in allyship with Indigenous resistance and resurgence. And these questions come from Janice Brooks. As we think about moving to action, she asks, what does it mean to dedicate my career to the land while also working on Indigenous territories? How have Western systems of science shaped how I understand or overlook Indigenous knowledge? What responsibilities come with the benefits I have received from this place? I'm a settler Canadian with ancestry predominantly from Ireland, and I think a lot about what are my accountabilities, not just personally, but also professionally as a social worker to work in allyship with Indigenous peoples and the original caretakers and the future caretakers of this land. So I invite you to think about these questions and also consider, as we decolonize or strive for decolonization, how do we see ourselves as expressions of the land? As not just here, individuals to dominate and have ownership of land, but to actually be a part of the greater, wider ecosystem. Separate and distinct, oh, thanks, Lee, for putting that in the chat for the calls to action. Separate and distinct from our land acknowledgement is our commitment to reparations for people of African descent. I'll post a link in the chat a little bit to our standards that talk more about our commitments to decolonization and reparations. But we understand at the college that reparations are not just a moral obligation. They're not just something they're important to do because we feel about a certain way. It's important as well to align resources. So it's a material obligation. And for us, it looks like 5 things: restitution, compensation, rehabilitation, satisfaction, and then guarantees of non-repetition. And I'm just going to highlight the restitution today, advocating for measures that restore lost rights and reverse past injustices. So when we think about reparations, it's not just about the past, it's also about the present, it's about the future. When we're thinking about reparations, we're thinking about historical African Nova Scotians, people who have legacies and ancestries with the Black Loyalists, the Maroons, and the Southern American Black refugees, and also really considering the ways that African Nova Scotians and people of African descent have also greatly contributed to the political, cultural, and economic landscape of the province. It is also African Heritage Month, and the theme this year here in Mi'kmaq is strength and unity, moving forward with purpose, prosperity, power, and progress. So I invite you to consider the ways that you can uphold this theme and work towards reparations and challenging of white supremacy, again, taking an active stance and active anti-racist stance throughout the year, not just on sort of token days or weeks or months, but upholding these principles every single day as a social worker. And when we talk about taking an active stance, it's thinking about our code of ethics and standards of practice. We really need to be deepening our practice around social justice, anti-oppression. And this is a meme from Twa Marie, or Tori Smith. And she writes, decolonizing and politically educating ourselves are forms of protection, self-love, self-care, and community care. So as we think about the learning and unlearning that we do in these PD sessions, ultimately what I hope that we're all striving for is liberation for all people. Oh, pardon me, didn't mean to open that to my personal Instagram. That's my link. Bear with me while I open this back up again. I do invite you to look up Twa Marie, though, just post some really amazing stuff. So today we're helping you build some knowledge and skills and values, or shift or develop those knowledge, values, and skills around acceptance and commitment therapy, and how you might be able to apply it in your own practice when thinking around body image. Of course, for social workers registered with the Nova Scotia College of Social Workers, you can track this under formal professional development, so please do that. For others who are joining from other jurisdictions or colleges or associations, this will probably count towards your continuing education requirements as well. And finally, before I pass it over to Lee and Raquel, this is grounded in our new code of ethics. And I really just wanted to highlight valuing human relationships. So as we think about the content today, it's grounded in all these principles and our values, but I wanted to highlight that social workers place the well-being and interests of all people at the center of their relationships, and that social workers continue to develop self-awareness and practice self-reflection to guide their practice and personal well-being. I invite you to hold on to these principles as we navigate the content together today. With that, I'm going to pass it over to Raquel and Lee, who are going to lead us through the session. I will be here if you folks need anything. The chat is open, and encourage folks to engage in the chat, but also use the Q&A function if you'd like as well.
All right, awesome. Thank you so much, Tyler. And Raquel's going to get the slides up and running. Fabulous. So hi, everyone. My name is Lee. And Raquel, I'm wondering if you want to put your voice in the room real quick before I continue with the intros.
Yeah. Hi, everybody. My name is Raquel.
And we are both members of the Aleo Collective. So the Aleo Collective is an interdisciplinary collective of eating disorder and body image professionals. Right now, it's made up of myself, Raquel, and our wonderful dietitian, Courtney Vickers. I myself am located in Amiskwachee, colonially known as Edmonton, Alberta. But the vast majority of my work happens on the East Coast. So I was in Fredericton for many, many years, and I'm registered with the colleges in New Brunswick and Nova Scotia. And Raquel, I saw you on mute.
Yeah, sorry. I was like organize everything technology wise and wasn't really listening to what you said. But just to quickly introduce myself, my name is Raquel Griffin. I use she, her pronouns, and I'm joining this call located just outside of Jabuktuk, colonially known as Halifax, Nova Scotia. Am I missing anything, Lee? Sorry that my brain blipped out there for a moment.
Nope, that's great. For folks checking out the chat, Tyler's putting in the presentation link and lots of other awesome links. I could have mentioned I use they, them pronouns as well. And we've got our links there for like how to check out our website and email us. We are really hoping that if you have questions throughout this presentation, that you will put those questions in the chat so we can answer them. But if questions come up sometime after this, we are welcome to hear from you at any point in time. We don't want the learning to end today. For today's presentation, Raquel, if you want to, perfect. For today's presentation, we've already touched a little bit on who we are, so check mark on that. We're gonna talk very briefly about what is acceptance and commitment therapy. For folks who, I guess maybe to even just set some like expectations for today, we're going to talk a bit more specifically about how ACT can be applied for body image specifically. This isn't meant to be like an in-depth comprehensive acceptance and commitment therapy training. If ACT is we have some slides where we're going to talk about this, but if ACT is totally new to you, that's entirely okay. If ACT is something that you feel very competent and confident in, we're hoping that you'll come away with some ideas about how applying it might look in a body image context specifically. And if all of this is totally new to you, then great. If you take even one thing away and you're willing to try it out with your clients, that's awesome. Or even if the only thing that you take away is you're like, this seems really great, and I also want to get quite a bit more training in it, fair enough. We have already absolved ourselves of needing to teach a comprehensive acceptance and commitment therapy training in 90 minutes. So yeah, and then we're going to talk about our case study. We love using case studies in our presentations to really try to make things as specific as possible. This case study is not going to be a real client, but sort of an amalgamation that we feel will likely feel familiar for a lot of you. We'll talk about what applying ACT looks like, and then we're going to chat a little bit about Befriending Your Body, which is our group that we run, which is an ACT group for body image. And that's today. We're going to have lots of questions throughout that time. But we want to get a bit of a sense, Raquel, next slide, please, of a couple things for you folks. So we don't have like Zoom polls set up, but what we would love to do to get people figuring out where the chat is for you to open up that chat function and put a bit of a number in here. So we've got, how familiar are you with ACT? 1, I'm pretty new to ACT. 2, I am familiar with ACT. Or 3, I consider myself very knowledgeable about ACT. Just for us to get a bit of a sense of who's in the room. Lots of 2s. Okay, couple 1s, couple 3s. Oh, yeah, 1's coming in. 2.5, love it. Okay, so we've got quite a spread. Lots of 1s and 2s, and then kind of the occasional 3. So we might spend a little bit more time on some of the ACT concepts. And also maybe this will just wet your whistle and you'll pursue some more ACT trainings, because I think it's definitely a modality worth getting trained in. I'm a big fan of it. So awesome. Thank you all for that. Don't leave that chat quite yet, because we have another question for you. How comfortable are you with conversations about body images? Sorry, I'm just looking. I noticed the word client snuck in there. How comfortable are you with client conversations about body image? So not necessarily personal conversations, although there might be a bit of a ratio there too. Number 1, I steer the conversation away from body image, or I refer out. It's outside of my scope, or I'm uncomfortable with it. 2, I want to have the conversations and I feel like I need more skills to have those conversations. Or 3, I feel confident and competent when it comes to body image work with clients. Okay, lots of 2s coming in again. Oh yeah, couple 3s. Some people 2 to 3. Okay, not noticing nearly as many 1s in this particular thing. So we were, okay, interesting. We're going to shift to the.
That's cool, yeah.
Yeah, I was like, which is awesome. It's still going to be ACT for body image, but what I'm realizing is we sort of made a bit of an assumption that it was going to be for people who knew a bit more about ACT and were applying it with body image. And now I'm realizing this is actually a bit more about people who already work in the area of body image and using some of the ACT concepts to apply. And I think we can make that without making any changes to our slides and simply changing a little bit about how we talk about it, which rocks. And so I'm really glad that we asked those questions, and thank you all so much for participating in that. As we're chatting, Raquel and I might put some resources or some questions in the chat, so feel free to put your own questions in there as well. And I'm going to pass over to Raquel to talk a bit more about ACT.
Yeah, how to summarize it without talking for 2 hours. It's a bit tricky, but I when you put up the numbers of like, how familiar are you with ACT? Like, I even feel like I don't know, maybe like a 2.5. I still, as a clinician, still feel like a little bit new to ACT as a modality. I've been using ACT as what I call like my therapeutic home base for the last 2 years. And when I attended a training for it 2 years ago, it really shifted my practice. It really was, I discovered the therapeutic home base that I had really been looking for. Of course, we're going to bring in approaches and modalities that fit best with a client or presentation, and of course based on like what we have training and experience and education in. But sometimes it can, at least for me, I found it a bit difficult to be able to have like an anchor or home base therapeutically that I could that I could come back to, or that was kind of like applicable almost no matter what was walking in the door. And for me, at least as a clinician, I have found that in ACT, and it's something that I find I apply in my own life all the time. And so for me, like if it's something that really fits for me and that it's doable and realistic to implement in my own life, I've found that that's the case for a lot of my own clients as well. So I'm still like new-ish to ACT. So, if you're feeling that way, you're in company. But I'll give a little brief overview here. So ACT, it stands for Acceptance and Commitment Therapy. But it's referred to as ACT, the word, like the verb, as opposed to an acronym like ACT, or to spell it out or say it out the full thing each time, acceptance and commitment therapy. And I'll get to why in a moment, but it's a third wave CBT modality that emerged in the 80s, I believe, by Stephen Hayes and Kelly Wilson. And part of how it was really distinguished from or diverged at the time from traditional CBT approaches was really this shift around locus of control. So maybe traditionally with CBT, there was a lot of kind of like engaging with the content of thoughts. So, what we call cognitive restructuring, or basically trying to change the way that we think. And so maybe thought records come to mind. Excuse me. Is this thought labeling it as a fact or an opinion, or maybe what's the hot thought? What evidence do I have to support this thought? What evidence do I have to challenge this thought? Like really kind of putting thoughts on trial and trying to really emphasize those alternative or more helpful ways of thinking. So, we call them often automatic negative thoughts or cognitive distortions. And, how can we think more positively or in a more helpful way? I'm like really boiling it down here. I acknowledge that. So there is this underlying belief there of like, okay, thoughts are something within our direct control. Like we can change the way that we think directly by engaging with the content of the thoughts in this way through cognitive restructuring. And then ACT comes along and says, what if we can't control our thoughts? What if we actually don't have uncomfortable or unpleasant or painful thoughts and emotions within our locus of control? What if thoughts and emotions are instead automatic, something that happens, something that therefore is normal and not within our control, not our fault? So ACT is really not about trying to change negative thoughts really at all. It's about trying to accept these uncomfortable thoughts and emotions that are here and how to make space with them, perhaps instead, how to become maybe a bit less stuck to them or unstuck from them. We'll get into that more. And so there's 6 different concepts in ACT, or sometimes referred to as processes. And they can kind of be sort of boiled down to being based in mindfulness and or being based in values-based actions. So in traditional CBT, where maybe the therapeutic outcome was a reduction in symptoms, with ACT, the therapeutic outcome is about values-based actions. Like, is this individual living in alignment with their core values? So in ACT, we're teaching, even though we don't really necessarily use these terms much or if at all in ACT, we are teaching emotional regulation. We're teaching cognitive diffusion, which we will explain what we mean by that more. And we're teaching behavioral activation. We don't call it that in ACT, but we are helping folks to move closer to making changes specifically and explicitly that are aligned or in alignment with their core values. So this phrase of psychological flexibility is kind of the cornerstone of mental health in ACT. Again, it's not about the absence of or reduction of symptoms, but instead, is their values congruent behavior when uncomfortable emotions and thoughts are showing up? What's the relationship like to that pain? How psychologically flexible is this individual? So hopefully that was like a helpful summary. But I have found, Lee and I have both found, it's a modality that mixes really well with other modalities, especially because it's a very dynamic approach. The 6 processes or concepts, they're not applied in any particular order. You will come to learn in this presentation that there's quite a bit of overlap amongst a lot of them. And so it's quite a dynamic approach, the way that they can be applied. There's no specific like ACT protocol really for whatever concerns are coming through the door or individuals. It doesn't vilify or pathologize body image concerns, really sees all behaviors as serving a purpose. And the thing, specifically that I really like about what we're doing here with body image today, even though Lee and I are both primarily eating disorder clinicians. And so often when we're working with body image and folks' relationship to their bodies, it's often primarily in the context of like the body weight or shape, like as it relates to like body image disturbance within an eating disorder. But we all have a body, and bodies are like a very like political thing. And so body image can really show up, with a lot of clients in a variety of different ways that don't just have to relate to eating disorders. It can relate to, what is someone's relationship with their body as it relates to like the color of their skin, of their ethnic background, with people of color or racialized folks, or with gender, or with chronic illness and people going through really like difficult medical conditions or health issues. So it is something that I find more and more coming up in my work, even with my non-eating disorder folks. And it can be applied across the spectrum of severity and diagnoses, whether it's, different presentations or levels of severity with disordered eating or eating disorders, but also other mental health issues as well with anxiety disorders. Is there anything that I missed, Lee, or that you want to add?
No, I think you've covered lots, and we can talk a little bit about some of the things that ACT does target, and then dive into our case study. There are some questions in the chat, and I was wondering if you wanted to maybe address those also in the chat, even if you want. People would love to know about what trainings you recommend. I recommended the PsychWire trainings, and some through contextual consulting are the 2 main places that I've done ACT training myself.
Yeah, contextual consulting is great. I personally did a 2-day training with Carolyn Martin 2 years ago. I don't know how often she's offering those trainings, but that was really great. Yeah.
Okay. So like Raquel talked about a bit, ACT targets psychological inflexibility, and we try to build psychological flexibility. So ACT doesn't work on the idea of, well, if you don't like your body, then simply start liking your body and then you can do stuff. Instead, we learn to have a relationship with our difficult thoughts. So when we talk about psychological inflexibility, a lot of the time, the way that I talk about it with my clients is I'm like, it's just like physical inflexibility, where a lot of the times it's not necessarily going to be a problem, but if you need your body to move a certain way and it doesn't, all of a sudden it causes a problem. And so the idea behind psychological flexibility and building psychological flexibility isn't that like, it's better that my wrist goes this way than goes this way. It's just that being able to have a range of motion is going to increase the number of movements that I can do in my life. And so psychological flexibility is really, really similar. So when we're talking about targeting psychological inflexibility, we're going to get a bit more in depth with this when we talk about our case study in just a second. So I'm not going to spend too much time on each of these concepts or principles or processes. But looking at a dominating concept of the past or future. So people spending lots of time thinking about the past, thinking about the future, and not a lot of time connecting with the present. Cognitive fusion. And this is where my it doesn't even feel like a scandalous therapy opinion anymore because I just have said it so many times is I'm like, oh, therapy is kind of the same, which is obviously not true. Different therapies are different. The other main therapy that I do is IFS, so obviously quite different. But cognitive fusion is something that we target in lots of therapies as well. This idea of you are not your thoughts. Your thoughts are something that is separate from you. Experiential avoidance. Different ACT clinicians are probably going to have different processes or concepts or principles that they focus more on. Experiential avoidance is one that I focus a lot on. People avoiding partly external experiences, that's a little bit easier to track and notice, but often people are avoiding difficult internal experiences. So they're not just avoiding going to the water park, they're avoiding the discomfort that they feel when they are at the water park. Unclear values, which is often one of the things that can fuel experiential avoidance. This is actually something that I remember specifically doing with my own therapist years and years and years ago, where they had me do a bit of a values exercise. And I was like, well, do you want me to do the values that I actually value or the values that I kind of live my life valuing? And they were like, talk me through how those are such different lists. And that was that was sort of my introduction to ACT, and it was a real light bulb moment for me. And then persistent inaction, impulsivity, or avoidance, which we see in lots of our clients. And then attachment to the conceptualized self, which sounds like a really woo-woo and out there concept, and is in some ways. And so that's one of the things that again, because IFS is the other main therapy that I use, and it gets, I think, a lot of extremely fair critique for being a little bit, bringing a degree of spirituality into the therapeutic space. But it is not the only therapy to do that. And ACT actually pretty unabashedly does that as well, with this idea of self as context and thinking about what it means to be a person experiencing the world, and that kind of humanness element, which is where it ties in with a lot of different philosophical traditions, especially sort of some Eastern philosophies. So that's our super brief overview. Oh, I forgot we had a question slide here. Hilarious. We went back through and added in a bunch of question slides because we were worried we were just going to monologue without taking a breath. So I know that we haven't super gone into depth with any of those concepts because we are about to introduce Jessica, our wonderful case study, who we're then going to be applying some of these concepts with. With ACT, we try to be a bit experiential and a bit more practical. So that's why we're not just here are the concepts and let's talk about them in theory. We really want to talk about what they could look like with Jessica. That being said, if you have any questions, we would love for you to post them in the chat.
There was one, does the client identify with an eating disorder or come to you because of another identified issue? For me, most of the time, I promote myself primarily as an eating disorder clinician, or what I kind of like to say, body, food, eating stuff. My very fancy clinical term, because it's a much more vast spectrum than just eating disorders or non-eating disorder issues. So most of the time, folks are coming kind of identifying, a problem with their relationship to food or eating or their body. Where it gets a little bit murky sometimes is, I think in part because I'm a certified intuitive eating counselor. And so sometimes people seek me out looking for intuitive eating counseling. And because diet culture is so tricky and often morphing and shifting into, whatever is fitting with the culture at the time, where it might not be like as overtly like diet culture. Unfortunately, diet culture has kind of like co-opted a lot of the language and even the term of intuitive eating into like another diet. So I do sometimes have folks come to me that are really, what I would say, like, yeah, there's disordered eating, or yeah, they have an eating disorder, and where they might not have like necessarily identified that or identified, you know, the the connection to diet culture and the connection to food scarcity and how that might be contributing to their relationship with food or eating now, or how that might be contributing to like binging if that's happening, or any other kind of like disinhibited eating, like what some folks might call like emotional eating or stress eating. But what about you, Lee?
Yeah, it's not always clear to me if people come specifically because of eating disorder stuff. Partly it's a little tricky for me because I haven't been accepting new clients for a hot minute now. But I get a lot of clients coming to me for IFS because that's like something that I specialize in and have a lot of training in. But even early on in my career, I remember being like, am I working with a lot of clients with eating disorders just because I'm asking about it? Because I definitely have lots of clients who've kind of done the therapy thing, but haven't necessarily addressed their relationship with food in their body. But it's a pretty standard, like I don't have like a, here are my 10 intake questions that I do, but I have a handful of things that I always ask about. And one of the things I do ask about is, what does your relationship with food in your body look like? I wouldn't always ask it in exactly that way, but because of that, I think it can be easy as a clinician to think, if this was a problem, my client would bring it up. And that's not true.
Yeah.
So
Mhm.
that's actually not part of this presentation, but if the only thing you take away from it is, maybe I could ask my clients if like how their relationship with their body feels, I would love for that to be a takeaway.
And
I'm
actually,
also,
we kind of cover that a little bit in the last presentation that we did with Courtney for the Nova Scotia College of Social Workers, which is available on YouTube. It's called "But What Do I Say?" Kind of navigating whatever the tagline was, conversations about eating disorders with clients. So maybe check that out.
yeah. The other thing, I just want to be a little bit mindful of time, but I see that there's a question about, do we see many neurodivergent clients? Yes. I think, Raquel,
Yeah.
the practice that you're at now specializes in neurodivergent clients, correct?
Um, two of the four of us, yeah. It's not
Okay.
necessarily like this is a neurodivergence like practice, but it is something that we all work with, and two of the clinicians specialize in
Yeah.
it. Yeah.
And Raquel herself just helped out with building the NEDICS resource for neurodiversity affirming eating disorder interventions. So we can put
Oh
that
yeah.
in the
I'll
chat.
put that in.
Um, and I work with a lot of neurodivergent clients because I have quite a bit of training with ADHD, and I also work a lot with the trans community. So the overlap is not insignificant there. Um, and then someone asked me about help explaining values in an understandable, pragmatic way for clients. And I think when we get to the value section, we will hopefully be able to answer that question. And if we don't, I would love to see you back in the chat asking more questions about it, because I really want to make sure that you leave with that question answered. So, Raquel, I'm going to toss it over to you to introduce our case study.
Yeah. And I just posted that in the chat, the link to the resource. I did some consultation work with NEDIC recently, which is the National Eating Disorder Information Center, on a collection of resources for both clinicians and clients when it comes to that overlap of eating disorders and neurodivergence. So there's like a whole lot of collection of resources in there that I've linked there. So we thought it would make most sense to kind of have a case study to come back to in discussing the 6 different ACT concepts and what applying them could look like. Um, and as Lee said earlier, this is like really an amalgamation of like kind of most frequently like reported, like when it comes to like the clients that come to us with body image concerns. So it's pretty accurate in terms of like how common a case study like Jessica is for other of us at least. So Jessica is a self-described plus-sized cis white woman in her mid-30s. She's tried several different diets over the years and finds that she is able to lose a modest amount of weight, but that it always comes back eventually. And she is currently at her highest weight. Jessica tells you that when she was a teenager, she was teased about her weight and felt self conscious about her body, and says, "But I wasn't even big back then. Now I would give anything to be that size." Jessica feels very self conscious about her body size. She avoids shopping with her friends because she can't buy clothes at the same stores as them, and avoids going out to restaurants with them because she's afraid that people are judging her food choices. She avoids having sex with her partner because she doesn't feel attractive at this size. Her partner wants them to take a trip to Mexico this winter, but Jessica feels she needs to lose at least 20 pounds before she can even consider it. Jessica feels frustrated that she is so preoccupied with how she looks. She tells you, "I wish I were confident and just didn't care what anyone thinks of me, but that's just not who I am." Jessica says her treatment goal is to feel better about her body so she can live her life to the fullest. So we're curious, this is a very common kind of presentation for Lee and I, but what about you folks? Do you have clients similar to Jessica? If you again want to put a number in the chat to let us know. 1, yes, definitely sounds familiar. No, that doesn't sound familiar. Haven't had a client like Jessica. 3 was Jessica and Ken. Thanks for that one, Lee. So lots of ones. Yeah, okay, a lot of ones. Yeah, working with teens is different for sure. 3 just for fun. Thanks for that, Alyssa. Mixing it up a little bit, keeping us on our toes. Okay, cool. So Lee's gonna cover the first 3 concepts here.
Yeah, so we're going to talk about kind of what these concepts look like actually applied in practice with Jessica. We're seeing lots of ones in the chat, which is awesome. That was kind of our hope. We're also seeing like a fair number of 2s. And so I do want to make sure that like for folks who are like, this is not what my clients present like, I would love to hear a little bit in the chat, like what it is that, like how it is that your clients present. So we can try to tailor some of this information to be like, well, what would this actually look like for you in your sessions? I know there are like some people here who work with teens specifically in the way that that's different. I know that like working with kids and youth is neither of our specialties. I made a point of getting out of the children and youth game pretty early on in my career. But we want to try to apply this as best we can. So we're happy to brainstorm with you. So when we talk about ACT targets, psychological inflexibility. So the psychological inflexibility here, the first concept, dominating concept of the past or future. One example of this in Jessica's case is Jessica tells you that when she was a teenager, she was teased about her weight and felt self-conscious about her body, and says, "But I wasn't even big back then. Now I would give anything to be this size." So when we talk about what that dominating concept of the past or future looks like, sometimes this can be in terms of anxiety, like thinking about, well, what if this happens in the future? What if this happens in the future? Sometimes this can be in the past in the sense of like negative stuff that's happened in the past and this feeling of kind of being stuck back there. Something that I experience a lot with the clients that I have around body image is this idea of things were better in the past. Things were better in the past when I was smaller. And so I might not have appreciated it back then, but I should have. And if only I could go back in time, or if only in the future things will be different. And one of the big things with ACT is that present you is the only you that you have any control over. Even, and I say this to my clients, I'm like, even if I say at 4 o'clock today, I'm going to do this, what I'm really saying is at 4 o'clock today, I hope present me does that, because I have no control over what future me does. And so this idea of present you is the only you that you have any control over. So being able to notice what's happening in the present is a really important skill, partly again with all therapy is kind of the same idea, where mindfulness is really important. We can't do anything about stuff we don't notice. But also this idea of it's part of why we bring so many experiential things into our session is if I'm asking a client to do something outside of session, I'm really decreasing the likelihood that they're going to be able to do that, because present them is the them that they can have some control and influence over. So this dominating concept of the past or future, if you want to hit the next slide, please, Raquel. Flexibility is contact with the present moment. And there are certain ways that we do this in ACT, but really any sort of mindfulness practice can be helpful here. Something I end up saying a lot with my clients, and Raquel, you can do the next slide where the thing pops up. So what are you feeling in your body right now? Anything about right now to me is mindfulness. And I end up doing some mindfulness stuff that looks a bit more like diffusion. This is where Raquel said there's a lot of overlap in these concepts, where being able to notice what's happening in this exact moment. So anchoring is a big one that I use here. I'll talk about anchoring with people as this idea of when a storm rolls in to a harbor, ships put down their anchor, not because it stops the storm from knocking them around. The storm's still going to happen. But the anchor gives them something to hold on to. And so anchoring is just a mindfulness practice of being able to notice what's happening in this moment, what's happening in my surroundings around me, what's happening internally. What this can look like in other therapy practices is that idea of like, can I notice my thoughts, right? It's the catch it, check it, change it, if you were doing CBT. It's this idea of, can I be aware of the present moment, and can I be aware of my brain pulling me out of the present moment? Minds are going to wander. It's what minds do. When I'm doing a mindfulness exercise with someone, letting them know it's really normal for their brain to start going, and what am I going to buy for groceries later? And we don't have to beat ourselves up for that. It's, can I then gently guide my attention back to this present moment?
Next one, Lee.
Yeah, I'm a little worried about spending too much time on any one particular thing. So we are going to have a question slide, I think, at the end of this 3. And
Yeah.
people, I'm seeing lots of activity in the chat, which rocks. So I'm happy to answer questions, but I'm worried if I spend too much time on each of them, we're going to end up rushed at the end. So let's be rushed in the middle, so that way we're not rushed at the end. Another inflexibility, experiential avoidance. This is the one I could talk about all day. So some of the ways that this showed up for Jessica, she avoids shopping with her friends because she can't buy clothes at the same stores as them. She avoids, I think, eating in public because she felt self-conscious is another one that we mentioned. She avoids having sex with her partner because she doesn't feel attractive at this size. She avoids going to Mexico because she thinks that she can't enjoy it unless she's 20 pounds lighter. Those sort of experiential avoidances tend to be the ones that we're able to notice more easily because they are external experiential avoidances. Even though we know as ACT clinicians that what they're really avoiding is the internal experience. She is avoiding shopping with her friends because not being able to buy clothes at the same stores causes an internal experience that's uncomfortable, and that's what she's avoiding. She avoids having sex with her partner because that causes this internal experience of discomfort. One of the ways that's more subtle, and that's one of the ones that we want to highlight here, is where Jessica says her treatment goal is to feel better about her body so she can live her life to the fullest. This is where a lot of clinicians who are maybe less experienced with ACT collude with experiential avoidance without necessarily being super aware of it. And Raquel, you can bring up the next 2 points if you want. Where our client is sort of saying, I want to feel better about my body so that way I can do the stuff in my life that matters. And we sort of go, yeah, so let's get you to feel better about your body so you can do the stuff in your life that matters. And that's us colluding with this experiential avoidance because we're sort of saying, yeah, we agree. Until you feel better about your body, you can't do the stuff in your life that matters. Whereas ACT goes, can we accept this painful feeling? Can we make space for this painful feeling? Can we accept that some things in life are uncomfortable and do the things in our life that matter anyway, which is where this ends up tying in with committed action. So a lot of what ends up being really tricky work with our clients is sort of this idea of what if we could live our life to the fullest, do the things that matter in our life, even if we didn't necessarily feel good about our body. There's a book that I really, really like, that we really, really like, that we use quite a bit, called Living with Your Body and Other Things You Hate, by Emily Sandoz and Troy Dufresne. And it's, I think, so helpful because it reframes that really beautifully. It's, yeah, again, not wanting to spend too much time on it.
I was
Acceptance
going to
ends up
show
being,
the cover and I'm like, where did it go? I can't
oh, I was
find
like,
it
Raquel's
right.
vanished. Okay. Yes, we can put the name of that book in the chat as well. And yeah, again, not wanting to spend too much time on any one point. I'd rather answer people's questions than elaborate too much. But experiential avoidance and like acceptance, I would say, is uh like, it's not, even though it's one of 6 concepts, it's not 1/6 of the work that I do with people. It's the majority of the work that I do with people. Inflexibility, cognitive fusion. So this idea that our thoughts are fused to our face and we can't see around them. So Jessica avoids going out to restaurants with her friends because she's afraid that people are judging her food choices. This idea that this is what people are thinking. This is where some of the like more traditional cognitive behavioral therapy stuff can be like helpful in our toolkit as clinicians, because being able to name things as, oh, that's one of our all or nothing thoughts, or that's our thought that's saying this is what people are thinking, that's our mind reading thought, those can be helpful. Where it ends up being a little bit different in ACT than in more traditional CBT is, instead of going, oh, that's an all or nothing thought, so we have to get it to stop being an all or nothing thought and realize it's irrational before we can then do the things that matter, we can just sort of name it and notice it and then still do the things that matter. We can act in a way that isn't actually aligned with our thoughts. My thoughts might say, oh, that person's going to be mad at me if I bring this up, so I can't bring it up. Whereas my actions might be, I can bring it up even though I'm also noticing the thought that someone might be mad at me. Or yeah, Jessica feels frustrated that she's so preoccupied with how she looks. Cognitive fusion can look like overly agreeing with our own thoughts and not questioning them and thinking they're true. Cognitive fusion can also look like fighting with our thoughts. So that's that idea of Jessica feels frustrated that she's so preoccupied with how she looks, is she has the thought of, I care about how I look, followed immediately by this thought of, I shouldn't care how I look. It's dumb that I care how I look. I'm so frustrated that I care how I look. If only I could stop caring about how I look, then I could do the things in my life that matter. So that sort of struggle switch that happens. And Raquel, you can bring up the other 2 points as well. So flexibility is diffusion. This idea of, can we defuse from these thoughts? It doesn't mean that that the thoughts stop being there. It means that we stop grabbing onto them so tightly. So I can notice the thought that I'm noticing the thought that I'm worried this person is thinking about this. I'm noticing the thought that this person is judging my food choices. I'm noticing the thought that I care about how I look, and I'm noticing the thought that I wish I didn't care about how I looked. That's one of those things that feels subtle and sometimes almost feels pedantic, but is a massive difference in terms of how people relate to their thoughts. So we have a question slide here because this is also where we're going to switch over, and Raquel's going to talk about the next 3 concepts. I wanted to check in, Raquel, you've been monitoring the chat. Are there some questions that we should
There
be
was
addressing?
one. I'm not totally I don't know if I understand the question totally. If this person maybe wants to clarify, it says, isn't the future you based on motivation and commitment to change? So I don't know if I totally understand the
Oh,
question, but a note kind of on this word like motivation, because I'm wondering maybe if what this question is getting to, it reminds me of this idea, an act of willingness. So like motivation often being described as like a feeling or an emotion, like of course often people wanting to feel like XYZ, wanting to feel a certain way, wanting to feel motivated, preceding an action. Like, yeah, that would be great. It'd be great if you like felt differently and then therefore you had the motivation to do XYZ. Given our locus of control, like given, behaviors are really the only thing within your locus of control right now. that's really the only way, like the opportunity to influence possibly our emotions or thoughts can occur. It doesn't guarantee it, doing the thing even when we don't feel like it or aren't feeling motivated to doesn't guarantee that then motivation will come. But that action preceding that belief or those thoughts, emotions is kind of the only way that those feelings that we want to be there can come, is if they have that opportunity. And so willingness is really the word that we kind of explore more often and act with folks. Can you be willing? Is there willingness? Is that person willing? And willingness meaning like giving permission to make a choice. And especially like what I like to talk about with folks is even looking at avoidance as being under that umbrella of behaviors, not doing something is still kind of behavior adjacent, right? Like even avoidance or like persistent inaction is still a choice. Like if like, yes, we understand, it's because of XYZ, why this individual might be making those choices, but kind of reframing it as it is a choice. Like it is a choice that you're making, and choices are going to have consequences. And so I like to bring in, when talking about willingness, I bring in this like Yoda, I think it's a meme, this Yoda meme often that I show with folks that says, do or do not, there is no try. And so that's kind of where like a little bit of the commitment piece of ACT comes in, is connected to that willingness. Can you be willing to do this thing that you've described is connected to your values, even while noticing anxiety or even while noticing shame or embarrassment?
Yeah. Yeah. And I think that question around the future you, as well as, because I was talking about present you is the only you that you have control over. And so future you based on motivation and commitment to change. Like you said, this idea of can we do these things even if we don't feel motivated in that moment? And also it brings up this idea of sometimes throwing things to the future is a form of avoidance. How many of us have been like, that's future me's problem? Future me is going to feel really motivated to do notes in a way that present me does not. And so being able to notice like present me is actually the only me that I have any control over, can really help to build this idea of, even though I don't feel that motivation, or even though I would rather delay it, or even though blah, 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 I can still do this thing that aligns with my values. I'm also seeing the question about like how we can apply this to teens being bullied for their body. Like I won't go to the gym. I won't go to gym because other people make fun of me in my gym clothes, or I don't want to come to school because people are making fun of my body. This is also where a big part of ACT is looking at the concept of workability. So avoidance is only a problem if it's a problem. And whether or not it's a problem for this particular student, I can't really say. But this idea of like, and I say this to clients, I'm like, we avoid stuff all the time. We avoid touching hot pans. We avoidance is not a problem unless it's causing a problem. And so the idea here isn't that we are targeting all experiential avoidance. It's we're targeting the experiential avoidance that's causing problems for my client. Yeah, I'm hoping that explanation kind of makes sense. So this idea of if I avoid X thing and it actually solves the problem in a sustainable long-term way, that's probably not, that avoidance probably isn't causing any problems for me. Like if I'm avoiding, if I'm concerned about getting in a car accident and the way that I'm addressing that concern is by wearing a seatbelt, that avoidance is probably like, because I'm avoiding the anxiety. I'm avoiding the anxiety of driving in a car without a seatbelt. That probably isn't causing me any problems. If I'm avoiding like the fear of being in a car accident and I'm avoiding that by refusing to get in cars or walk on a sidewalk if cars are present, that's probably really impacting my day-to-day life functioning. And so it's similar if we bring this into like a body image perspective. Where it becomes tricky is when there are those like external outside constraints. And like I work with the trans population, I am well familiar with those external outside constraints. But we can also look at the ways that we're bringing some of that internally, right? Is there a part of us, well, I slip into IFS language so easily. But like, is there a thought process that, although, you know what, ACT uses parts language too sometimes, it's fine. Are we noticing the thought? Is there a thought that, therefore, if I wear something and people make fun of what I'm wearing, that it's my fault somehow, or that I need to agree with them, or that I need to not care about it? That's something I run into a lot. And we even used in the Jessica example, people feeling like, well, if I was truly a feminist, or if I was truly confident, or if I was truly whatever, I simply wouldn't give a shit if people were mean to me, which is also a fantasy of avoidance, right? If I walk into a room and I think everyone loves me, or if I walk into a room and I think I don't care what anyone feels or thinks about me, those are both a desire for a pain-free experience. Whereas the idea with ACT is, can we accept or be willing to experience the pain that feels most in alignment with our values? And I see one other question, then I'm going to throw it to you, Raquel, around does repetition of the repetition of diffusion, does that make a difference in effectiveness or make it feel less pedantic? Lots of eye rolls. I have had to do so much work around receiving eye rolls in my own work, because I think, and I'm a real eye rolly kind of, like, I grew up in a real eye rolly sort of like mindfulness, like yoga. You tell me to go for a walk, like, please. And so I think being able to have a really solid foundation for ourselves about, why am I asking them to do this? Do I truly understand why this is important? And if it does, can I make a bit of a pitch? And can I make a pitch for us to go, again, even though this is us learning to sit with our own discomfort, even though I know my client doesn't like this right now, can I do it with them anyway, because I know that it can be helpful for them? And so this is where, with the idea of choosing the pain, I can either choose the pain of, I'm doing something that I think is helpful for them and like helping to follow through on this, even though they and I are feeling some discomfort around it. Or I'm accepting the pain of, I didn't do something that I think was helpful because I thought my client wasn't going to like it. There's pain either way. Can I choose the pain that aligns better with my values as a clinician? I do find, like with a lot of things, repetition ends up paying off in a big way. And I don't tend to be like, when they say like, I hate this, I don't tend to be like, you noticed the thought that you hate this or whatever. I tend to just, as I'm summarizing back to them, using a lot of that language. And after a couple sessions, I notice my clients starting to do it. And then when I notice them starting to do it, that's when I tend to highlight it and being like, whoa, you were able to say, instead of like, and then I was so anxious, and then I noticed such an anxious thought, and I'm like, whoa, and I make a big deal about it. So that's sort of my strategy, and I'm going to throw it to you, Raquel, partly because I'm going to have a big coughing fit, and partly for time.
Okay. Yeah, and I just want to quickly read a really great comment. I do want to note that the term motivation can be problematic when we consider diet culture, plus size, or fat. As a fat person, I like to reclaim the word. People are often considered to lack any motivation or are lazy. This argument often is used to make fatness a moral issue. I love that this person brought this up. And this is something that we talk a lot in session, that I talk a lot about in session with my clients, and exploring, defining what diet culture is, and it being a system of power that like subjugates certain types of body and elevates other types of bodies, and how that like harms a lot of people. And so, yeah, like understanding like, okay, when this client is saying motivation or accountability, what do they mean by that? Like, can we tease that out a little bit more? And like, can we like, explore that a little bit? So, inflexibility, as that relates to unclear values, what that kind of sounds like a little bit, at least in the case study that we've heard from Jessica. Jessica says that her treatment goal is to feel better about her body so she can live her life to the fullest. Great, but like also like pretty vague. Like what I hear there is there's like a lack of clarity or lack of specificity around like, what does that mean for her? Like, what does that look like? And why is it so important to her? Like, obviously it's so important to her, that it's getting, oh my gosh, wait, what am I trying to say? These are things that are really important to her. And so what's getting in the way of that, and why is it such a problem for her, right? Like, she's situated a lot of these things as being like a problem for her. And so psychological flexibility, part of what helps facilitate that is helping clients to make contact with their core values. And this can be done like in a variety of ways, like some different examples of like what that can sound like in session, or what questions maybe you can ask people is, if you were living your life to the fullest, like what would that look like? What would you be doing differently? And often I find like, um, often I find I have to specify that, of like, what would you be doing differently? What would you be saying yes to more of? Like, what would you be saying no to more of? Really focusing on that action or those behaviors, and helping clients to discover or define like what that would be. What in your life is most meaningful to you? What matters to you? What are you about? That's like a big ACT phrase. So making contact, or helping facilitate clients to make contact with their core values, sometimes it is about like kind of taking a step back from the problem, and kind of having these conversations about like, what does it mean for you to live a life that's fulfilling for you? Like, what in life as a human is most important to you? What do you hold most dear? What's really meaningful and what matters to you? What are you about? So kind of inviting them to imagine their life without the problem. And at some point, like, inviting them to actually name and identify what are these core values. And I have found like a really helpful entry point into helping clients make contact with their core values is kind of using that problem talk to mirror core values. Like, often when clients come to therapy or counseling, they're talking about the things that aren't going well. They're talking about the problem, or why like something is a problem for them. And so being able to listen for and highlight and kind of throw back to them to either like confirm or deny, like, what's the core value under that? If it's really bothering her that she's not going out to dinner with her friends, that she's, that she hasn't had sex with her partner in like X amount of years or whatever, if that's a problem for her, hearing in her description and, saying something to her like, it sounds like it really bothers you that you're not connecting to the people that you love, or it sounds like connecting with the people you love, or having intimacy or trust with your partner is something that's really important to you. Like, is that fair to say? What do you think? So being able to kind of use that problem talk to as a mirror to reflect their values. If you were struggling with these things, what would you most want in your life? Or again, like, how would your life look different? What would you be doing differently? So as far as like, experiential stuff or practices that we might do either in session or as home work or home practice, most often the most straightforward way is doing a values checklist, like kind of like how Lee mentioned. There's kind of often no other way around it, to really be able to name and identify what that person's core values are. And so it's like a big sheet of a bunch of values listed off, and they come away at the end with naming and identifying 5 core values, like whittling it down to 5. And I don't think I've ever had a client that said like, that was really easy, right? Like, people usually really struggle with it. And the most common thing I hear is like, oh my gosh, it was so hard to get it down to only 5. Like, really, I can only pick 5. And it's like, yeah, like, we can't have 20 core values. Like, where's the direction in that? Our values are like, and the ongoing way we want to behave, the ongoing way we want to live our life. It's not a destination, but it's like an ongoing living movement, a direction. You can't, if you walk in the direction of north, you won't eventually reach north. It's not a destination, but we can walk in the direction of it. And that's what's driving that desire to like walk in the direction of like, I want to walk towards north. It's this way. Hopefully that makes sense. And the other practice I bring up a lot with folks is we talk about death. That tends to really like often bring into focus like what really matters to us. Like even if in our own lives we've experienced death or we've had people we love close to us die, or maybe we've had a really traumatic near miss like ourselves, or just like a really significant life change that's been really painful and difficult, that often like unfortunately it often kind of seems to have to take those things for what really matters to us to come into focus, our core values to really come into focus. And so instead of like waiting for those like really painful, terrible things to happen, we talk about that in session. We talk about death. We invite people to, I keep saying we, but I guess I invite people to think about this deathbed, hopefully very old, like version of themselves that has an opportunity to write a thank you letter to you today. And that this deathbed version of you is 100% content with the way that you've lived your life. And there's a variety of kind of basically sort of journal reflection prompts to guide kind of people through exploring, what might these core values be for me? How do I want to live my life? What do I want to be about? So psychological inflexibility as it relates to persistent inaction, impulsivity, or avoidance. So obviously there's kind of a lot of overlap here when Lee was talking about experiential avoidance and kind of acceptance, the concept of acceptance being kind of like the other side of the coin for that. Here's how we heard this in the case study. Jessica avoids shopping and eating with her friends and having sex with her partner. Her partner wants them to take a trip to Mexico this winter, but Jessica feels she needs to lose at least 20 pounds before she can even consider it. And I already kind of touched on this a little bit in the last concept of contact with values, because again, there's a lot of overlap here in ACT. And so, yeah, and I kind of talked about this already a little bit, even with what I was saying about willingness and giving ourselves permission to make choices, even when we don't feel like it, even if we don't have the energy or we don't feel motivated or we don't feel confident or happy, that it's not a prerequisite to feel those things before doing things differently, especially if those hard things, those things that are feeling really hard to do right now, are worth doing because they really matter to this person. So I won't add too much there, I guess, other than to identify the how this looks flexibly psychologically is the concept of committed action. So it's a little bit more defined. If contact with values is like the compass of like, here's the direction of north, committed action is, you could kind of see it as goal setting, I guess. It's the Google Maps. It's the here are the steps to take, or here are the turns to take, and here's how long to stay on this road. It's more specific. So if we've previously done this contact with values work and this individual has been able to name or identify some core values, that's the driving force, that's the direction. Okay, what are the specific actions? What are the behaviors that show up on the surface with those core values like underneath it and fueling it and in alignment with it. What are those goals that this person wants to make? What feels important for them or most doable for them to change first, or what's that next step for them? This could sound like in therapy, it could sound like the clinician asking, what is one choice you could make that would move you closer to doing those things? So I use a whiteboard a lot in my sessions. And in ACT, I never know if I'm like, I don't want to call it a concept because it's not, but I guess it's like an illustration of called Choice Point. And there is like a worksheet that you can do with folks with it. It's quite detailed. I guess if people maybe were in need of some more support or structure around goal setting. But I tend to do like an abbreviated illustration of this, where the idea is if you're here, but you want to be here, like this is Jessica's fulfilling life that she's mentioned and like feeling better initially, right? And if this is the other direction, it's, not a fulfilling life and not feeling better. The idea being every action that we take from an ACT perspective, it either moves us toward where we want to be or away from where we want to be. So exploring with Jessica, what is one choice you could make that would be in this direction, that would move you toward where you want to be? Or I guess how it's worded here is move you closer to doing those things. So talking about choice point, also talking about how, once we've identified those core values, how are you living in alignment with those values now? Like kind of assessing what's that looking like now for you. There's almost always things that people are already doing that are in alignment with their core values, but that's usually not the reason why they're in therapy. But that's kind of some strength stuff to, highlight and bolster up. But there's a practice I do usually in session with folks. I don't usually give them a worksheet, but to save time from me not using my whiteboard, I'll just show you. There's this bullseye practice that I walk people through where there's this bullseye that they draw, and it's split into 4 different quadrants of life areas or life domains. So when we think about our relationships, and we give some examples of what we mean by that, with our work or vocation, with leisure, and with health or wellness or well-being, inviting them to like throw a dart or to mark where they feel like they're landing right now in a given moment. So if the middle of the bullseye is I'm living in alignment with my values, and the outside of the bullseye being I'm not living in alignment with my values. So the closer we are to the middle, the more we are living in alignment with our values. Where would you put yourself in each of these quadrants when you consider these core values that you've named and identified? How are you living those out right now when it comes to work, when it comes to relationships, for example? And it often coming back to locus of control. What can I control? What can't I control? What am I willing to do or to change first? Oh, why is that there? Oh, it's going backwards. Oh, I didn't know it would do that. And then the last one, oh geez. I'll try to blow through this really fast. I feel like Lee should have done this one because they're like the IFS, specialized person. But psychological inflexibility as it relates to over-attachment to part of the conceptualized self. So this one like gets a little bit heady, but here's like how we kind of hear that in the case study possibly. Jessica feels frustrated that she's so preoccupied with how she looks. She tells you, I wish I were confident and just didn't care what anyone thinks of me, but that's just not who I am. And in ACT, that's like a big like ding, ding, ding of when folks say, that's not who I am, or I'm not the kind of person that, fill in the blank. Those are big kind of like dings for, okay, there's like a fusion or an over attachment to a part of the conceptualized self. There's like a sticky, goopy, I use those words a lot in ACT. There's a sticky, goopy part that they've like made this generalized evaluation of, that it feels like this is who they are. This is the only part of them, because it feels like it takes up so much space because it can be so painful. So there's a lot of opportunity to overlap with cognitive diffusion here too, but the psychological flexibility that can be fostered with this concept is self as context, which is part of why like contextual, Lee mentioned contextual consulting, where you can do some PD related stuff, part of where they get that word. So self as context is like, I call it kind of like the parts work concept, even though that can show up obviously in other ACT concepts as well. But if we kind of quickly boil it down to like, there's a version of the self that's observant, and there's a version of the self that's transcendent. So observant self being, there's a version of you that can notice things. Like there's a self that lives outside your body. Like there's a part of yourself that's outside of your body, your observant self, and the transcendent self being this connection to greater humanity. So there's a lot of overlaps here with self-compassion work, and that comes up quite a bit here in ACT. And like how that can look, especially while doing diffusion, is there's a part of you who's noticing these thoughts. And one of my favorite practices to do with folks, again, is sort of another journal prompty exercise that I do in session with folks, called Cup Full of Words, where I will invite them to finish a sentence that I prompt them with on all of these little different pieces of paper. And then they put them in this cup, and we talk about, the self being the cup, that they are the cup that is like a continuous, unchanging container. And it contains all of these parts that we like about ourselves, parts that feel good, and also parts that we don't like about ourselves that feel really painful. And that we're not just one part, we are not our thoughts, we are not our pain. But that the self, at least again from this self as context concept or perspective, is the self is actually unchanging and continuous, but contains all of these parts with lots of different feelings. Like if we were to like pour juice into the cup, it doesn't change the cup. The cup is still the cup. And I use the metaphor often of like, you are the sky. Like the sky is a continuous, unchanging container, but what it contains within it is the weather. And there's certain kinds of weather that we tend to ascribe as being like, enjoyable or nice or good, and then other kinds of weather that like we don't like so much. Like we have another snowstorm today, where school's canceled, and I'm sure lots of people
Raquel,
have feelings about that.
I just want to flag for time. It's already 1:20.
Yeah.
Okay.
And so being able to see ourselves not as like the snowstorm and like, God, like why again, but more to see ourselves as like a step back from that, and that we are the sky. So I probably didn't tie that off in a super great way. How would you know if you were that kind of person? And there's another great chess metaphor too that I won't get into now, but someone actually did mention something about a chess metaphor in the chat. So that's fun to see. So Jessica, with psychological flexibility, imagining she's come through therapy and she's now like demonstrating like increased or greater psychological flexibility. How might we know that? She's willing to notice and accept painful thoughts and emotions when they show up. Jessica is able to see these thoughts or emotions as separate from herself, observing them rather than fusing or fighting with them. She looks to her core values, connection, adventure, compassion, as her compass for what to choose and how to act. And Jessica lives out her values by going on that desired trip, saying yes to that restaurant invite from a friend, buys or wears clothes that fit or respect her body size and shape. So that's it for like the ACT component of today's presentation. And just to quickly plug the group that Lee and I are going to be running. We're going to be running our third cohort of a body image group that we've named Befriending Your Body in March. It's a 6-week closed group and it's based on ACT. We're the facilitators, and we're going to post in the chat in a moment some more information about that in case you're interested in passing on to your clients or sharing with your network. We administered a pre and post tool called the BIAAQ that measures psychological flexibility, specifically with body image, with our group members. And the results were like super cool and really impressive in that literally in every single item on the tool, there was improvement compared to the pre-testing for the group members, which basically that means people came out of this group with improved body image, with more psychological flexibility as it related to their relationship with their body. Okay, sorry, I'm done.
Okay, awesome. Thank you so much. I know we got to throw it over to you, Tyler. I'm going to answer some other questions in the chat because I know you got to wrap up.
Yeah, and I just, again, amazing job. I'm so grateful to work with both of you. This is the second time you folks have done a session with us while I've worked at the college. And like many of the attendees, I was really grateful for the things you were sharing in the chat. I was like downloading them and emailing them to myself while also trying to pay attention to your presentation. So thanks for also not just offering up content from today, but like supplementing it with so many other resources and things that people can apply. Much appreciated. I'm going to share my screen as we do our wrap up here. Bear with me while I get this set up. Perfect. So hopefully you folks can see my screen now. Again, yeah, we were here today for our acceptance and commitment therapy for body image. I do hope that you check out the Alio Collective and some of the other offerings they have. That cohort in spring looks really rad. I think there's things we can all benefit from learning about ACT and also our body image and how pervasive these issues are. And thinking back to the land acknowledgement, I'm, wondering what are the ways that as if we see ourselves as expressions of nature, as expressions of the land, as a continuation of a greater body, how might that shift how we see ourselves as well? Would love to hear from folks in the chat, something, to wrap up your time with us today. So is there an idea that you heard that you'll take with you to your practice, or is there anything else that you want to share as we close out our time together? Love to see that in the chat. As well, would love for folks to fill out our evaluation survey. I'm going to post that in the chat as well. You can use this QR code. It'll also be emailed out after the session later this afternoon. And just love hearing your feedback. Please do share with us. I also share the feedback with Raquel and Lee later on in a summarized format. As we wrap up our session today, I wanted to share this quote from Wild Seed Society. They say, liberation, happiness, freedom, all are possible in your body, in this place, and at this time. When we think about the rise of fascism, authoritarianism, when we're seeing the rising inequities, we also have to hold on to a sense of hope, and a critical hope that allows us to believe that freedom and liberation and happiness is possible, and not just at the societal level, but also within our relational levels and within ourselves. And so I just hope that through this session today and any other PD we do, that it helps trigger some thoughts in you about like what is possible in terms of liberation and what is your role in striving for liberation. We have tons more of activities coming up that you might be interested in. You can look to our newsletter. We'll have one newsletter out today, goes out every 2 weeks. You can also subscribe to our Eventbrite. We have lots of cool sessions coming up. I also want to highlight, Lee, I think you mentioned, or Raquel, you mentioned, someone in the chat talked about the chess metaphor. That's actually our BSW student, Maya, who's here in the room next to me right now. And she's going to be leading a session on March 20th around intuition, bias, and ethics and social work practice as part of her practicum. I'm really excited for that. That should be available for registration today. We also have lots of other cool things coming up. I'm excited for a session next week on prevention of social polarization and extremism. We have lots of closed group spaces for communities of practice. We have a session with Amy Pinell, the sensitive social worker, on March 23rd around emotional resilience and healthy boundaries. And then, of course, it's going to be National Social Work Month here in the next little bit. So on March 2nd, we have a kickoff meeting. We'll be talking a little bit about social work history and social work present and social work, where we're going in the future as a college, with some content for myself, Robert Wright, our council president, and our executive director, Registrar Alex Stratford. And that is it for today. Lee or Raquel, any other final thoughts you want to share as we wrap up our time?
No, thank you so much. There were such amazing questions. We could have talked for a lot longer. And thank you, Tyler and NSCSW. Thank you so much for having us.
Yes, thank you to everybody that came and contributed and participated. Always such a pleasure to come together, and thank you for listening.
Thanks for being here. And I know, after the last session folks led, people were really hungry for more. So I'm grateful that you're back and looking forward to seeing what we can come up with together in the future. But with that, I'm going to stop recording and say thanks, folks, and feel free to leave when you're done. And hopefully you have things to look forward to.